Hi, I'm Jessica Thomas, Director of Patient Education for the NET Research Foundation. Some of the key concepts that we're going to talk about today is how stress is inevitable. What are some tools and strategies that we can have to work around it? Fatigue may be a part of the symptoms that you experience. And again, what are some of the things that we can do to work around that? And emotional wellness and mental wellness is a really important factor of a good quality of life when living with NETs. And what can we do to help foster and improve it? This information is going to be useful if you are a patient living with NETs, or if you are a caregiver even. This information and tools and resources are things that we all can utilize. Let's go ahead and get started. So what is the connection here? There's a great connection with stress, fatigue, and mental wellness, and it can actually be kind of messy. So sometimes we may experience fatigue, and our fatigue may be because we have been very stressed out, or our emotional wellness has not been good. We've been experiencing symptoms of anxiety or depression, etc., and that may lead us to feeling more fatigued. Or stress may be the main factor in that. So as you can see, these three topics really can interact and interfere with one another. And what we're going to do is we are going to use tools and strategies to approach both stress, fatigue, and mental wellness. And so knowing that any of the strategies that we utilize today, one thing is going to help the other. Right there, at the bottom of the slide, you're going to see that there is a toolbox icon. Anytime you see that toolbox icon, I want you to visualize that this is a tool that you can put in your toolbox to help you in times that you're feeling stressed or in times that you needed to improve your emotional wellness. So for managing stress, here's a couple of things that are important. While stress is inevitable, we can avoid unnecessary stress. We may not have control over all of the stressors, but we can learn to alter some of the situation that you have, some of the things, some of the aspects that might be causing some of the stress. We can learn to adapt to whatever the situation is at hand, and then also learning to accept the things that we cannot change. With managing stress, there are all sorts of different tools, such as exercise, meditation, yoga, relaxation, progressive muscle relaxation, breathing, biofeedback. Those tools are really important, and today I'm going to share a few of them. But for now, let's talk a little bit about managing fatigue. So managing fatigue, if you live with cancer-related fatigue, there's a couple of tools and strategies that will be helpful for you. One is that you are the professional of your fatigue. And so understanding it is incredibly important. So become the expert in your fatigue. Perhaps keep a fatigue journal, understanding kind of what your contributors to fatigue are. So that way you can avoid them. If it is perhaps staying up too late at night and you realize that that's a contributor to fatigue, then modifying your bedtime. Taking a rest when you need to. Now, one of the suggestions for taking rest is making sure that you're taking small periods of rest. So 30 minutes at a time, making sure that you're setting an alarm if you're taking a rest during the day. Prioritizing tasks. Eating well, as eating and nutrition can definitely affect how we're feeling and our energy levels. Having movement, yoga as a part of our daily routine. And finding help and accepting help when it's offered to us. Now, fatigue can be kind of tricky. There's different types of fatigue. There can be cognitive fatigue, and there can be physical fatigue. And sometimes our emotions, our mental health can affect how we feel and can absolutely affect the level of fatigue that we have. So it's important to know that while living with fatigue might be a part of your NET journey, understanding your triggers and then also letting your healthcare team know that you're experiencing fatigue. If you're unable to manage some aspects of your fatigue using strategies such as the ones I talked about, it's important to talk with your doctor because fatigue can absolutely affect your quality of life. So there's enduring and versus temporary, and reactive versus proactive resources. And since we're going to be sharing some tools today, it's important to know that some of the tools and strategies that we use are enduring and some are temporary. For example, one of the temporary tools would be going to dinner with a friend. If I had had a very stressful day and I went to dinner with a friend, that would be a temporary tool. I would feel better at first, but then later the effects of that wear off a little bit. Whereas practicing mindfulness, meditation, or yoga may have some more enduring. Now, both of those types of coping mechanisms are important and they both have a place, but it's good for us to know what things can help us for a longer period of time versus what is more temporary. And then there's also reactive versus proactive management of fatigue and stress and mental health. And so the reactive is when we notice that we have a lot going on and we need to implement a self-care tool or self-care strategy right away. And then the proactive tools are the tools that hopefully that we are going to put in place and integrate those into our daily lives so that way we can have them as a more of a constant tool and strategy to live well with our disease. So if you can see, the toolbox icon is there. So this is one of the first tools that I want to share today. And this is called STOP. So this is a really good tool to use every day, but also if you're feeling that your stress level is higher, or even your fatigue level is higher, or your mental wellness is challenged a little bit. So the first thing that you're going to do is you're going to stop whatever you're doing. And then you're going to take a couple of deep breaths. And when you're breathing, it's good to breathe in through your nose and out through your mouth, and to just take maybe 10 deep breaths if you can. Observe how you're feeling and what are your needs. Do you recognize that you feel tired, or do you recognize that maybe you feel overwhelmed? Are you hungry, perhaps, or do you need to rest? And then what are the next steps that you need to take? So observing what you've observed, what are the things that you can do to take care of yourself? Maybe thinking, what is the next step that I can take to take care of how I'm feeling right now? So that's tool number one. The next thing that we're going to do is talk a little bit about breathing. Again, this is our toolbox icon. So breathing can help us with stress management. Breathing can help us with fatigue management to some degree, but it can absolutely help us with emotional wellness and mental wellness. So the first type of breathing I would like to talk about is box breathing. And with box breathing, you are going to essentially be drawing a box, as you can see in this image. So what we'll do here to go through is we will inhale for a count of 4. So you inhale for 1, 2, 3, 4. You hold for 1, 2, 3, 4. Then you exhale for 1, 2, 3, 4. And then you hold again for 1, 2, 3, 4. And you do this breathing for several series. For some, you may want to do it for 5 to 10 breaths, but either way, it can help kind of reset your mind a little bit, calm you down. Now, the other type of breathing is pursed lip breathing, and I also call this 1 to 2 breathing because the exhale is twice as long as the inhale. So for this, you breathe in through your nose, and you would breathe in, say, for a count of 2. So breathe in for 1, 2. And then you exhale for 1, 2, 3, 4. And again, this breathing exercise is good to repeat for several sessions, and it will ultimately help you to calm your vagus nerve, which helps to calm your autonomic response system. It's both breathing exercises are great. There's no favorite between the two, but it's important to take time to stop and practice mindful breathing. So this other tool right here is a permission slip. Often when we are feeling stressed, we rarely give ourselves permission to take care of ourselves. Or if we're feeling fatigued, sometimes it's hard to even give ourselves permission to listen to what we need to do to reset and to feel better. And sometimes if we're feeling overwhelmed, and it's hard to give ourselves permission. So I am giving you a permission slip right here. And I hope that you take it with you, and I hope that you use it often. I found that when we're intentional and we write and give ourselves permission to do things, we tend to feel less guilty and bad about. So I'm giving you this permission slip for you to use and to think about, what do I need to give myself permission today? Is it to practice yoga? Is it to slip away and to read a book if you need to, or to talk to a friend, or to take a 5-minute mindful walk around your neighborhood? Whatever it is that you need to do, I want you to remember in your toolbox you have a permission slip and you can give yourself permission to do so. So when do you consider seeing a counselor for your NET journey? If you have uncontrolled stress that you're dealing with, that might be a sign or a time to go see a counselor. Or if you're newly diagnosed and you just want to talk about some of the challenges that you're experiencing, that's a great time too. If you are dealing with a lot of fatigue or struggling with how to work out self-care for yourself, that's a good time to see a counselor as well. Or if you're dealing with feelings of anxiety, depression, sadness, grief, loss, or you just want someone to talk to. To be honest, having a counselor as a part of your healthcare team is never a bad idea. So I hope from this session today that you took some valuable things with you, to know that you can put tools in your toolbox, use things to help you, and to customize ways for yourself to help to manage stress, to help manage fatigue, and also to ultimately really to cultivate emotional wellness.